In healthcare, you are taught different ways you can protect yourself from getting sick when you're working with patients who may or may not have an infectious disease. So I'm just going to go over this because I think that this is really important, especially nowadays with the coronavirus, so that everyday people can protect yourself from this virus. So first of all is the standard precautions, and it's the set of practices that healthcare workers use for any patients, no matter if they show any symptoms of being sick or if they don't. Because just in case they don't show any symptoms, you still want to protect yourself. So this is basically to protect yourself from the body fluids, non-intact skin, and mucous membranes from patients. So it's just the basics that you need to do. So making sure that you wash your hands before and after touching the patient, wearing gloves, wearing masks, respirators, or eyewear is also important, although it's not usually followed in the normal everyday use in the hospital. Usually it's just hand hygiene and gloves. Transmission-based precautions are precautions that you need to take in addition to the standard precautions. So for transmission-based precautions, it's when the patient is known to have a certain disease. And there are 3 types. There are contact, which is when the patient is known to have a disease that is spread by direct or indirect contact. For example, the norovirus, the rotavirus, draining abscesses, head lice, C. diff, etc. And this is where you wear gloves. You make sure you wear gloves and a gown. And sometimes if you know that you need to touch something dirty and then to touch something clean, you have to wear extra gloves, like maybe 3 pairs of gloves. This is what x-ray techs have to do if they are going into a patient's room and needing to take an x-ray and they're by themselves. You have to wear multiple gloves so you can touch the patient, then take off 1 pair of gloves and then touch the x-ray machine, and then touch the patient again if you need to, and then take off another pair, and so on. The next is droplet, and this is when patients have a disease that is spread by droplets of saliva or mucus when the patient coughs or sneezes or even talks. Examples of this kind of disease is influenza, pertussis, meningococcal disease. I don't know if I said that correctly. And what you have to do is wear a surgical mask when you come within 3 feet of being next to the patient, or if the patient has smallpox, if you come within 6 feet. The next is airborne, and this is when patients have a disease spread by fine particles dispersed by air currents. So airborne and droplet are kind of similar. However, airborne is way more infectious because the fine particles can land on things and then get disrupted and then come back into the air. And then also, the fine particles are way smaller than the droplets. When the droplets come off of the patient from sneezing or coughing or talking, they only land about 3 feet away from where the patient is, and then they don't get picked up back into the air. That's kind of the difference between airborne and droplet. Airborne diseases are very infectious, way more infectious than the droplet. So it's serious because there's a lot of contagious diseases that can be airborne. For example, tuberculosis, measles, SARS, and according to the CDC, the novel coronavirus is also airborne, which is bad when you're trying to contain the spread of a virus. The only way that you can actually protect yourself is when you wear an N95 mask or a PAPR, which is a powered air purifying respirator. And it is very easy to put it on wrong or take it off wrong, and then you can still get sick. So these are the 3 ways that you can transmit a disease. According to the CDC, the way that you protect yourself from the coronavirus is using standard precautions, so hand hygiene, gloves, and especially eyewear, which I hear that the first patients who were getting sick from the coronavirus were ending up getting the healthcare workers sick because the healthcare workers were not wearing eye protection. And unfortunately, when you're actually in the hospital, when you do standard precautions, it's most likely only hand hygiene and gloves. We don't really use eyewear very much. The CDC also recommends that if you are dealing with somebody with the coronavirus, to use contact precautions, so you have to wear gloves and a gown. There's been some patients who have had diarrhea and they found the coronavirus in the diarrhea, so you can get it spread through more than just breathing in the little particles. And then you also need to protect yourself using airborne precautions, which is wearing an N95 mask or a respirator. So I'd like to stress that it's bad to have any of these transmission-based precautions, but I always, because of being a student in a hospital for x-ray, consider airborne precautions as being the worst, according to how easy it is to spread. There can be a lot of diseases that are contact precautions that are way worse than diseases that are airborne. However, contact is less likely to spread. For example, Ebola, you have to make sure that you don't touch any of the person's bodily fluids, because the bodily fluids are what have the virus in them. However, it did not become really bad all over the world because it wasn't able to spread very far. All of the diseases that I have listed here are pretty bad, but airborne is way, way, way more infectious and easily spread to other people. There's a lot of people who are dying, but then a lot of people who aren't having very many symptoms, which is kind of crazy. But I would just say to be as careful as you can. Just try not to be out in public whenever you don't need to. I just want to educate everyone so that you can better protect yourself from getting the coronavirus. I hope you all are healthy and well, and thanks for watching.